Welcome to the office.
Hi, Kristina.
Hello.
Welcome to the office.
Thank you.
Where are you coming from?
Vancouver.
Vancouver.
Yeah.
What you doing here from Vancouver?
A lot of neck pain,
Okay.
predominantly on my left side.
Okay.
Headaches, shoulder pain, upper back pain.
This started all when?
So the neck pain was about 2013.
Okay.
I did get some neck pain when I was about 13. I did wrestling in school.
Okay.
And I'd come home with some neck pain.
Oh, sure.
And some stomach
I guess
pain.
of course. Okay.
Didn't really bother me throughout high school, but then around 2013 is when it came. Headaches started really in 2018.
Okay. We're in 2025.
Yeah.
So it's 12 years you're dealing with it.
Yeah.
So over the 12 years, you've been seeing people, or just
so neurologist is about 2 years now.
Okay.
But for my neck pain, like physio, massage, dry needling, all that stuff I've been seeing over the
Did
course.
anyone tell you what the cause is?
So my doctor says I have cervicogenic headaches.
Okay.
And then in 2020, they diagnosed me with chronic migraines as
Why?
well. I don't know.
Okay. I want to make a quick comment, if you
Mhm.
don't mind.
Yep.
Okay. And what happens, I hear these diagnoses. These are symptoms.
Yes.
We want to know why.
Yeah.
Right? Not just I have a symptom, but why do I have this?
Right.
So when I'm asking very specifically because we're trying to figure out what kind of answers people are getting, right? So you were active, you've slipped, you fall, you've dealt with stuff, you've gone on with life, right? As most of us do.
Yeah.
But when we're talking about, we have headaches, we have neck pain, neck tension, the way I look at it, and as you've watched videos, we're looking at the whole person.
Right.
And things down below affect up above and vice versa. And so when we're looking at, doesn't matter what the condition is, back pain, neck pain, digestion, headaches, migraines, whatever, we always have to look at the whole person. Make sense?
Yes.
Yeah, right. I think that's why you're here.
Yeah.
Okay. From all the stuff you've been dealing with and people you've seen, did you get any results with anything?
The Botox kind of helped for the first 6 months.
Botox where?
In the head and the neck.
Okay.
And then it kind of slowly stopped working.
All right, wore off probably.
Yeah.
There's a case that came to me, I'm just sharing a side note. This lady had an implant put in her neck with wires in her brain to stop her migraines. And what was really cool, we were able to she shut it off while she started under care, but now she has to go back and get that thing taken out.
Wow.
It was a little wild. Okay, so your main issue is headaches and migraines.
Yes.
That's number one.
Yeah.
Shoulder, neck, all that stuff.
Yes.
Tell me about the low back.
Low back, also around when I was 13, I hurt my tailbone. And I remember in like some of your videos, you see that can affect all the way up there because it still hurts if I sit for more than like an hour.
You're talking about the bottom tip?
Yeah.
Okay.
Yeah.
And wrestling?
No, I was on a boat for like 3 weeks, and every time I'd go over a bump, I would kind of hop a bit.
Okay.
And I'd fall on my tailbone.
Okay. Had fun on the boat?
No.
Oh. Okay. What else? Anything else?
That's probably it.
Good start.
Yeah.
And you're here for the week with us?
Yes.
Okay. What we're going to do, we'll go over your x-rays. I'll explain what I see first.
Okay.
We want to get the big idea, the whole picture.
Right.
Then we'll examine you, figure out where we're going to start.
Okay.
And let's see what happens this week.
Perfect.
Ready?
Yes.
Let's do it. So this is your 24-story building. And what you're complaining about is up on the top of the building.
Right.
But before we deal with the top, we've got to go to the bottom. Now, what's interesting in your case when we look here on your foundation, the first question is, do we have a level base and foundation? You're a tiny bit off. It doesn't seem so dramatic, okay? What do I mean by that? We have a slight rotation of the pelvis, 1 millimeter rotation of the sacrum, and a 2 millimeter measured difference, meaning a lowered leg on the right side.
Right.
And here's what's interesting. So 2 millimeters, it's under 7 millimeters, adjustments will hold, there's no intervention necessary there. You have what's called an ASEX or PIIN. That is significant, and that does tell us that was some fall, okay, because it goes against the normal joint mechanics. Typically, when it goes AS, anterior superior, it wants to come in. Yours went up and out.
Okay.
So what I'm seeing on that right side is this. It goes up 1, out 3. Tailbone comes back 1, and thing goes down 2. And again, that's slight. But what's interesting is you curve away from the slightly lowered leg. Follow my process.
Okay.
Okay. So the answer that we're going to get is actually going to be on this X-ray.
Okay.
But I want to just continue up here and see. So you tilt slightly to the left side. Overall, it doesn't look so dramatic. If we just look at this X-ray, this is a good example. So when we look at overall, it doesn't look so dramatic.
Right.
Looks pretty decent. Even your digestion, your Megan-Blasi is a good shape. Could be a little bit bigger in terms of digestion for HCL, but overall is great.
Right.
Okay.
Okay.
So let's go why are you dealing with all this? That's the real question. So let's go to the side profile. And this is where we're going to get a lot of the answer here. So on this X-ray, we're looking at 3 main things. Do we have the right curve in the neck? We should have a 40 to 60 degree forward curve in the neck, 60 in the back, 60 in the mid back, 60 in the low back. You have no curve. That's your issue.
Right.
Follow. So we don't have a curve in the low back. We have a sway back. And then it's almost like you have your primary C-shaped curve. That you didn't develop your secondaries properly, or maybe you did and some injury resulted in that. So let me show you the consequence. So loss of curve, if we're supposed to be like this, okay? So this is your spine.
Right.
And you should have that forward curve. So yours is doing this. You're straight, okay? Follow. You go back there, and then you have the reverse curve here. That's you.
Okay.
So forces of gravity kick in. That takes all the slack.
Right.
Okay. When we have the right curvature in the spine, and the good news is you can still develop it. You're still young enough. When we have the right curve, that's our shock absorbing mechanism. So going back here, going back to the X-ray, we want the right curve, number 1. Number 2 is the posture. When we look at the posture line, if you've watched me talk about this line should be going through the base of the neck here. So the upper part of your building is way behind the foundation, and the neck has to curve to compensate.
Right.
So all these muscles are just working overtime to kind of hold you upright. You working?
Yeah.
You sit?
This half sit, half mostly stand though.
Okay, so that's better. And I'll give you your habit changes, but that's the key. This doesn't loosen up until this comes forward, or there's always this imbalance. So your BMR, or what we call basal metabolic rate, the amount of energy that just exists in B, is too high for you.
Right.
Okay, follow. Make sense so far? So we need curve, and we need to push this thing forward. Now here's the good news. Your discs are great. Your discs are still good. 5, 4, 3, 2, 1, 12. These get a tiny bit thinner because of the loss of curve.
Right, okay.
And you see the way these are shaped. I think that's your wrestling, or that's something where you're in a lot of flexion all the time.
Okay.
All right. Now let's continue up. Okay. The discs are all good here. I'm happy with that.
Okay.
Even though you have this reverse curve, the good news is you don't have ligament damage. There's no disconnect in what we call George's line, and I've talked about it in previous X-rays. 2, 3, 4, 5, 6. It's starting at 6 and 7. 6 and 7 are close together here. And then these start to open up and compensate. So I wouldn't be touching any of this stuff.
Okay.
C6, C7, upper cervical, potentially yes. Migraines, let's talk about it. I've had hundreds, we can go into the 1,000 if we want to, migraine cases over the years. Everyone is different. So I've had migraine cases come from a hip adjustment. I've had migraine cases come from digestion issues. I have migraine, it can be anything.
Right.
Cervicogenic headache doesn't really tell us anything. But what it does tell us, based on what I'm showing you, is your imbalance. And the cervical imbalance, there is that component to your headache and tension.
Right.
Okay, does that make sense?
Yes.
All right, cool. You didn't hear any of this before, did you?
No.
No. Now let's get into the tailbone. And you got that old tailbone injury right there. So when we're looking at the sacrum, it should be a smooth art. You played hard, yo. She's a Canuck for sure. So S1, 2, 3, 4. You had at least 5, 6 good, good ones. So the coccyx is important in your case. Why? It is misaligned anterior, and anterior coccyx causes a slight loosening of the tone of the nervous system, so overall tone is low. We want to tighten that up a little bit, okay? So coccyx, tailbone, whatever we find in there, C7 and C6, C7. Now, to get the curve back, here's what's interesting in your case. That usually comes from either AS or IN ilium, not an ASEX, and not but your IN is your major here. So I have a suspicion that down the road, to help you get your curve, we're going to have to fix the IN.
Okay.
And what that is when you have an AS or IN ilium, there's a process called nutation and counter-nutation of the base of the sacrum. So when the SI joint, the ilium, when it goes PI back, the base of the sacrum wants to go forward, creates too much curve. When it goes AS or IN, it comes back, causes a straightening of it. So that's why I was saying part of that fix is going to be that. Make sense?
Yes.
Questions on the x-rays?
No.
Pretty straightforward, okay? Now, it may be a little spicy today.
Okay.
All right?
I'm ready.
Let's do it. Oh, they got good spicy food in Vancouver, too.
Yeah.
Have a seat over there. Starting at the base of the neck. And the first thing we're getting, C6, C7, left side. Tiny bit up top, 3 points, C1. Still going left, left. We're looking for that break to come back. There it is. L1, 5 points, T12, L1. Going down low, there it is. And it's down in the low, low, 10 points. Coccyx S5, T12, L1. There it is. So it looks like it's going to break in the mid-back, but all of this is coming from here.
Okay.
Interesting. So we have this one, T12, L1. We have coccyx S5, and then we have the base of the neck, 10 points, C6, C7, and a tiny bit up top at C1. So 1, 6, 7, 11, 12, 5 coccyx. Okay. Head down, please. Let's do static palpation. Static palpation, what we're looking for is swelling, edema, point tenderness, and you can see all of this. All that starts, dips in, the swelling goes, goes, goes. You can see it starts to pool and it sinks in right here. Tender?
Yeah.
That one more or that?
First one, yeah.
1, 2, 3, 4, 5, 6, 10, 11, 12, L1. Interesting. All right. L1 is a big hormone button, by the way, which can also cause it. Now, I have talked about it in previous videos. There is a particular essential fatty acid called choline. They found research years ago, decades ago, with migraine sufferers and choline deficiency.
Okay.
And so what we've done with that information is with people that have had it a long time is, I'm going to see if I get you a bottle of the choline. Okay. We do 1 bottle only, and either it fixes the migraines or it doesn't. Okay. Now, in your case, maybe it does, maybe it doesn't. I'll see how you do with first a couple of adjustments. Okay. Right there. 5, 1, 2, 3, 4, 5. Yes? Yeah. And now I'm on the outside. There's the coccyx.
Yeah.
Yes. L1, Coccyx S5. Let's check up top, please. 7, 6. Oi. Ah.
Oh,
yeah. That's 1 on the left. That's 1 on the right, the left. Okay, here's what we're going to do on the neck. We're going to wait on that till the end.
Okay.
I want to start on the tailbone L1, then I want to recheck the neck after that. But before we do that, let's watch you walk. Stand up for me, please. And let's watch the hips move. Walk to the end of the room and back a few times, please. Just whatever your normal walk is. So you did wrestling, you did hockey?
No, I did lacrosse, softball, and soccer.
Your right hip don't move at all. You got the BC wiggle when you walk. Sorry, no pun intended. So we don't really see movement going through her SI joint. She's very stiff. Mm-hmm. Okay, keep going one more time. I want to see these things move up and down. Yeah, it does this when you walk. It does like that. Okay, so that's a good test for us. Have a seat, please. All right, showtime. So the game plan for today. Coccyx will start here. Okay. From here, we'll go here, do more of Coccyx. We'll start L1 there. Okay. We'll have you walk after that, and then we'll check the neck if we're going to do the base or the top. Okay. Okay? Yep. Shall we? Yep. Come forward. There we go. There. You got to stretch her out. Good. There's the little baby one. Come up slowly. Slide up a tiny bit. There you go. All right. Let's close you up there. I'll be on your underwear, okay? I'm on the inside there. There we go. And we want to bring that out. There it is. Good. That's a piece. That thing been stuck a long time, girl.
20 years.
Damn. There you go. Gotcha. All right, let's bring it down. Let's continue a little more on that tailbone. There we go. And we want to torque it up. Gotcha. Nice. Okay. You all right there?
Yep.
Go. L1. 6, 7, 8.
Oh my.
That's the home run. Gotcha. Excellent. Gotcha. All right. Let's bring you up. Wait for it. Step back. I'm just going to put this on you. Hi.
Hello.
Come on, let's walk it out. And let me just check with the dimples. Let's open up the back. And let's take a look. Walk for me, please. Yeah. What's different as you're walking?
I don't know. It feels different. I just don't really know how to describe it. Just feels
Body's
like
trying to figure it out right now.
Yeah.
Okay, keep walking. Okay, come on over. Have a seat over here. Let's recheck. Good. All righty. Starting at the base. One is clear. Now we've got a little heat. Sweet. Tailbone is clear. Now let's see what happened up top. Base of the neck is there. Top is clear. We're going to do the base. Okay. So C7 is a PRS, so we're going to set it on the right side. C7, right. Right ear down, down. There we go. She's a little tall. Hey, drop that right ear down, down. There you go. Gotcha. That's the home run.
Oh, that felt good.
Walk it off one time, please, and right on back.
Feels like got a little bit more sway to it.
A little more swag
Yeah.
now. Good. Have a seat, please. Turn to the left. Look straight, sorry. Look to the left.
Oh.
Look to the right. Look straight. Look to the left. Look to the right. Different, yeah?
Yeah, it's harder going to the right.
See if I can get a little bit more alternate. There you go. Turn to the right. Turn to the left. Turn to the right. Good. Sit straight. All right. Let's rescope. Make sure you're clear. Take your time. Starting at the base. Neck is clear. Mid-back is clear. Now, you remember what that low back felt like, right?
Yeah.
That's all clear. Let's feel it again and see. That's where we're going to start. Okay, come on back. That's 5.
Don't feel anything.
That's 1. That's 2. That's 3. That's 4. That's 5. Different.
Yeah.
Nice. Cool. Let's continue on. I'm going to do your shoulders next.
Okay.
Right side. Let me do the work. Left side. Let me do the work. There you go. And let's go on your back and tune up your ankles. Sweet. Any questions with what I found or did?
Oh, no. Feels good.
Raise your right leg. AS talus. Raise your left. Talus. Sweet. Sit up and turn. All right. And now buff and polish. Vibration therapy is to break up scar tissue. Squeeze. Squeeze. Turn this way a little bit. Squeeze. Strong. A little bit on the elbow, on the inside, on the ulna.
Ooh.
Squeeze. Squeeze. Lunate scaphoid. Drop the shoulder, let it go. There you go. Squeeze. Questions? You're all set for today, okay?
Perfect.
Welcome to the office.
Thank you.
Awesome.